Dangerous health problem in the U.S. that you probably never heard of. And it's the reason one man was told he needed both of his legs amputated.
He gave up hope, but then he heard about a doctor in South Louisiana. Medical reporter Meg Ferris brings us his emotional story.
Every time you swipe a credit card, or get cash from a 24-hour bank machine, or have a medical claim filed electronically, or even search WebMD for health answers, you can in part thank this man, Fred Goad, who's been involved as the CEO or investor or co-creator. But for all of his success and connections and means, there was something this time Fred desperately wanted, and neither he nor doctors at several top institutions had a solution.
Except I was really trying very hard to save my legs.
Fred did not know he had PAD, peripheral artery disease. Just like in heart disease, the arteries become clogged with plaque. In PAD, clogs can be in the leg arteries, starving the muscle, skin, and tissue from oxygen-rich blood. Then one day, he went to a podiatrist to remove a small piece of glass from his toe that he'd picked up on the beach.
He said, you know what, there's no hair growing on your legs, on your lower legs. And he said, that's generally a circulation problem.
As time passed, the toe wound would not heal, going from black to gangrene. It was dying from lack of blood flow. He began going to the best doctors at the best institutions around the country for tests and medical procedures to open up the clogged arteries.
In Nashville, where I'm from, we do $72 billion a year in healthcare, one of the healthcare capitals of the world, and I couldn't get fixed in Nashville, Tennessee.
He was also prescribed 40-hour-long hyperbaric oxygen chamber treatments, boots to wear 3 hours a day to pump the blood down his legs. He tried a vibration plate machine and acupuncture, but it got worse. A top vascular doctor at a renowned hospital gave him the bad news.
You should have this amputation within 60 days. He said, and your right leg, think about doing that below the knee next year in at least the first half of the year.
The man who at 75 did an hour on the elliptical machine every day now made physical therapy appointments, prosthetic appointments, and went to talk to other amputees about how to live life as a double amputee.
They were telling me you're going to fall a lot and things. So we got with a renovator to renovate our home, to have non-skid floors put in, to change the showers where you can walk in, have bars, seats in the shower. Just bathroom, seats that were higher.
Just remembering is tough. It's emotional. No. Then one day, Fred got a phone call from a friend who heard from another friend about the double amputation, and that call changed his life.
He said he has done this before, and I hear he's very good at it.
Fred was told to go see Dr. Craig Walker at the Cardiovascular Institute of the South in Houma. He called and left a message.
Honestly, Fred, had you ever heard of Houma, Louisiana?
No.
But this is a worldwide problem. It's a huge problem. In fact, in the United States, peripheral arterial disease is more common than heart disease, which is our leading killer. It is rare for a person to have a severely diseased leg attached to a completely healthy person.
Fred was surprised when Dr. Walker personally returned his phone call.
People that treat you like you're substantial, he treats every patient the same way. He returned the call.
Dr. Walker treats patients from around the world with PAD. The goal? Amputation is the last resort. And he teaches other doctors the same. Doctors from all over came to New Orleans to hear him lecture at the new Cardiovascular Horizons conference. Amputees are at a higher risk to go into nursing homes at a 6-figure cost, lose their health and even their lives.
The science of our field has improved dramatically, but the practice of medicine has not yet caught up.
Dr. Walker sat Fred and his wife down after the exam and said this with confidence.
I've looked at all these studies, and I think there are 4 opportunities for me to get blood to throw through your legs. And he sat down and drew it out with us.
Finally, it was surgery day. Fred's wife got the news before Fred came out of anesthesia.
When I came out of the recovery room, as my wife was beside me and she was crying. I thought, well, it didn't work, and she went.
While Fred's PAD was from family history, Dr. Walker says Louisiana has a high rate of PAD because of the high number of smokers, diabetics, and people getting older. He has started efforts in school to teach about heart-healthful diets and not smoking. He also pushes the importance of early diagnosis of PAD. And it's working. Houma used to have the highest rates in the U.S. of both amputation and cardiovascular deaths.
Most recent statistics, we have the lowest amputation rate now in the United States, and we have one of the lowest cardiovascular death rates.
Fred is healthy and well, only using a walker for a couple of days because of a knee replacement infection. He believes divine intervention got him to Dr. Walker.
He was able to do what no surgeon had been able to do.
Meg Ferris, Eyewitness News.
A third of people who get amputations go straight to a nursing home and never leave, and that cost us more than $100,000 a year just for the facility.